I'm disappointed that there's so many of them, but I think all hospital and frontline workers should be vaccinated for the safety of who they're looking after.
I support the individuals who choose not to be tested or to receive a vaccine that at this time is still an experimental concoction.
The vaccine mandate's still a divisive issue as we receive updated numbers from Shared Health on the amount of direct care healthcare workers absent from their roles due to compliance with public health orders. Of the 42,000 direct care workers across the province, there are 161 who remain unvaccinated or refuse to be frequently tested and are on unpaid leave. According to Shared Health's latest numbers from the end of Wednesday, there are no cancer care employees off, 8 off from Interlake Eastern, 3 in the Northern Health Region, 23 in Prairie Mountain, 6 from Shared Health, 13 from the Winnipeg Regional Health Authority, and 108 from Southern Health Santé Sud. Knowing that some hospital staff can still work while unvaccinated if they agree to testing is a split issue for Manitobans we spoke to.
I would be very uncomfortable in a hospital being served by somebody that I knew wasn't fully vaccinated. I don't think that's acceptable.
I would be okay with that. I don't see one person at any more danger to one another whether they are or aren't vaccinated.
I think I would be very uncomfortable. I think when you go to a hospital, you're expecting a certain level of care, and I think part of that comes from the fact that you know that the people that are working there, taking care of you, are supposed to be taking care of themselves.
If they're negative, they're negative. They're the ones that take care of the people in the city, and you're going to penalize them for that, which I think is wrong.
I'd be afraid. In fact, my advice is don't get sick and don't go to the hospital.
Doctors Manitoba says they don't know of any physicians in the province that aren't adhering to the vaccine mandate. A statement reads, "Doctors trust the safety and effectiveness of the COVID-19 vaccines, especially their ability to reduce severe illness, death, and the chances of getting infected with COVID. That's why we called for a vaccination or testing requirement in healthcare, which the government then implemented." Shared Health says 36,079 direct care workers have indicated they are fully vaccinated, with almost all of those being validated already. Just over 92% of direct care workers who have responded to Shared Health's voluntary disclosure request have indicated they are fully vaccinated. 1,822 direct care workers require testing to continue working.
To be in a hospital knowing that people are not getting themselves vaccinated, it's not acceptable to me.
It's a controversial topic, so I think everyone is trying to do the best that I can, but it's unfortunate that people's livelihood is at stake.
Everyone should be vaccinated, frontline workers and everyone else.
As long as, you're carrying the PPE, if they offer a rapid test, go for it. It's either left side or right side. There's no really in between, in the middle right now as it stands, which would be nice if there was a middle.
I support the people who choose not to vaccinate. I support the people who do choose to vaccinate. It's a freedom of choice, in my opinion.
In Winnipeg, Mike Albanese, City News.